Hi, everyone. I'm Dr. Susan Blum, founder and director of Blum Center for Health. Today, I have the pleasure of talking to Dr. Jane Andrews, who is a physician here at Blum Center. And we wanted to share some information and just help you get to know her better, which is so much fun. And I want to welcome you. So thank you for joining us on the video today.
It's my pleasure. It's wonderful to work with you.
Excellent. So today, we're just going to get to know you. And so how about if you just tell everyone about your training and your background and sort of the story of how you ended up in functional medicine?
So I've been a physician for 12 years. I spent many years in conventional medicine and then many years in a bit of an overlap. So I did medical school at Johns Hopkins. I completed my Master of Public Health there. I did my residency training at Tulane. I was a clinical instructor there and then assistant professor. I also spent several years as an assistant professor at Yale.
So this is all in internal medicine.
Correct. Yeah. And then University of Texas, where I was associate professor in internal medicine. Starting about 2017, I became interested and really started my training in functional medicine. I would say I was interested for probably since residency because I had a sense that there were a lot of tools that were being left on the table that we just didn't have the training in and didn't have a chance to explore.
What did you love about internal medicine?
Oh, I love the academic rigor of it. I love the scientific mind about it. I love the evidence base. I love the sincerity with which doctors take their jobs. To me, it's a true privilege to be able to be involved in someone's health and to be on their journey to becoming well. And I take that seriously, and I'm extremely grateful for that opportunity.
Yeah. And so go back to how your internal medicine that you loved, though, however, the journey brought you into looking for more. It's not instead of, and I think that's a really important point to make for people, right? To understand that functional medicine is not instead of, it kind of layers on top of your background and your skill.
100%. You know, I think starting in residency, so I had some illnesses before residency that I was working through, and I realized, wow, there's a lot to this that's not a traditional pill that a doctor would prescribe you. And I found that there's just tremendous healing potential in some of these other modalities. And so what I loved about it was I felt like it opened this whole new world that was really non-drug company based, non-necessarily financially beneficial, but like worlds of healing in these communities of healers that really were exploring some incredible things.
So give me an example, like what?
Oh,
what's one modality that you love?
Well, for example, I mean, just foundationally what we do here at Blum, like the gut testing, microbiome testing, genetic testing, advanced lipid testing, hormone testing, things that,
to figure out the root cause.
Yes.
Like other diagnostics to figure out the root cause of what's going on.
Yes.
Right?
Yes.
It goes beyond what you get tested for in your doctor's office.
Yes.
In the conventional doctor.
I would say I have loved all of my medical career. So I'm not disparaging anything, but
it's a build on.
I've had many years of patients coming in saying, I feel bloated, I feel unwell, I feel malaise, I feel fatigued. And I feel like in conventional medicine, there's these limited number of things.
Right. There's for that.
You're like, well, I've got these 5 drugs. Here you go. I just knew there was more. And so the training that functional medicine offers has been really life-changing in terms of my clinical practice.
Right. So the tools to evaluate the gut, to evaluate toxin load and environmental toxins,
exactly,
to evaluate hormones. Even we have a deeper dive of how we think about that, right?
Yes.
And also using food as medicine and the effect of stress and trauma on how it affects hormones and the body and how it enters in and causes all these imbalances, right? We can measure. And so, which is very cool, right? And
it's very cool. Yeah. And I think part of what we do is we give people, I think people are getting more and more aware that some of these factors are critical in their health.
Yes.
But I also think that without knowing about your personal hormones, your personal lipids, your personal labs, your own genetics, it's very difficult to make some of the really tough lifestyle changes that we ask people to make.
Right.
And I know that from personal experience. I know that from family. I know that from my clinical practice.
Right. And it's interesting because lifestyle change can be very targeted, right? And a lot of times people and some of you listening might have gone online and decided to just follow this program or follow that program. And maybe some of them have worked for you. And a lot of times just a basic elimination diet and some basic lifestyle change, especially if it's new for you, might really help you feel better, which is great. And there's a personalization that can happen to help people go past that initial just generic, right?
Yeah, just as an example, so like a keto diet, that might work better for an ApoE2 than an ApoE4. Like there's just a lot of ways that
ApoE2 and ApoE4, do you want to just clarify what that is?
Oh, it's a gene. It's a particular single nucleotide polymorphism that puts you either more or less at risk for glucose intolerance, metabolic disease, Alzheimer's disease, and other things.
Genetic testing, right?
Yeah, so this is something we could do with genetic testing. Genova has like a bunch of companies.
You can get it tested from Quest too. They don't always cover it.
Yeah, but that's one
It's
example of taking 700 SNPs
of taking a data, right, of finding a way to personalize for somebody. Yes.
I think it's so important.
And their risk for cardiovascular disease, that's a really important gene for that, because if they have a certain kind of gene for that, then we worry a little more. And we want to take everything a little more seriously. And then we encourage people to take it more seriously, which is great.
Exactly.
Yeah. So great. So that's what excited you about functional medicine.
Yes. The expanded toolkit, the expanded curiosity, the expanded knowledge, the advanced labs.
Yes.
And the ability to address things that we just don't have time.
And so you can see the enthusiasm. I just want to say how happy I am that you've joined us here at Blum Center, and that you can join our team, because this kind of excitement and passion is what we all have here, and we're set up here so that you can actually practice medicine this way, which is really so
well,
great.
I have to say this is the other thing that really appeals to me about this clinic that you set up, is that we know that if I just see you by myself and prescribe these 5 things, it's going to be very hard for you to achieve your optimal health. Right. But with the resources, the support, the
nutrition coaching, and
the health coaching,
and even just all of us working together as a team.
Yes, the collaboration, the hive mind that we put together. So it's a very collaborative clinic, being able to ask each other clinical questions. What do you think about this case? What this one's a tough one. What do you recommend? Right. And we all just have different expertise to offer. So that's been really fun.
Yeah. Good. Excellent.
Yeah.
And so maybe we can just talk about specific things you're passionate about. So, or not things is the wrong word, but like, within the world of medicine, there's so many different kinds of health issues.
Yeah.
And we all are drawn to different ones, right? So I'm wondering if you want to share any of your particular passions that you really love to dive deep into.
I've done a lot of metabolic disease. I have a lot of experience in metabolic disease. I have a great interest in cognition and brain health.
Back up to metabolic disease for a second.
Sure.
So I'm not sure if everyone listening really knows what metabolic disease is or means.
Oh, okay.
So give us a little bit of a primer on what does it mean to have a metabolic disease?
So elevated fasting insulin, elevated hemoglobin A1C.
So diabetes.
Yes. Thank you.
Right. So
diabetes,
heart
elevated
stuff, cholesterol have a big belly, like inflammatory fat in the body, which can cause insulin resistance, some blood sugar issues, maybe, right? We call it all metabolic. We get into our, it's very easy. We can geek out, as we say, with each other, and we know these terms, but it's good to help define them. So for people listening, how would they know if they're a metabolic person?
Oh, there's some simple lab tests we can do to tell. Certainly, just phenotypically, being over, the way that you look, being overweight is a risk factor. It is not equivalent by any means, but it is a risk factor.
You're at an increased risk if you have overweight, especially if you have, we talk about the waist and hip circumference, right? So if you've got the belly, it's the abdominal fat, right? Which is the inflammatory kind of fat, which can increase the risk of insulin resistance. So it's that whole world of blood sugar stuff, right?
Yes.
Yeah, and that whole world of cardiovascular risk stuff, right?
Yeah,
and hypertension. It's like hypertension, cholesterol, diabetes, and all the inflammation in the body that comes from that.
Precisely.
Right?
Yeah.
Okay. So we refer to that as metabolic, but I know you love that stuff. So
yes. Visceral adipose tissue. There's other ways to measure it, but
I love it too. We love that here because conventional. We work with cardiologists all the time, right? That's really important, and we have for advanced imaging and for second, for other opinions.
Yes.
But there is so much that we can do to help people lower their cholesterol, lower their blood pressure, to reduce that whole insulin resistance, to treat it from a lifestyle medicine and a functional perspective.
100%. Yeah. There's a lot of overlap with hormones. There's a lot of overlap with toxins. There's a lot of overlap with just a lot of the other things that we're testing. It's all metabolic is never on its own, but
see, and thank you for saying that.
Yeah.
Because that's such an important point.
Yeah.
And that's what makes us not a cardiologist, right? We're different
Yeah.
because we take in everything that might be influencing
Yeah,
the
some of these root
inflammatory
causes that we're
process.
able to measure.
Right.
Autoimmune disease, I mean, there's like a lot of
Right,
association
and-
even with that,
Right.
with cardiovascular, as you know.
Yeah.
Yeah, so I think that step is super exciting. I think the data that we're getting around specific exercise protocols, specific eating protocols, specific lifestyle protocols like hot and cold therapy, somatic therapies, the data is just exploding right now, and I find it super exciting. It's just such an exciting time to be in functional medicine, really.
It really is. And, and one of the things I will say to everybody is we both have our masters in public health, which means like we geek out about the numbers and the data a little bit. So that's one of the things that I always loved about you since I met you, that I found in a kindred spirit, because I really do believe also in, evidence-based medicine and data, and that what we do here is data driven. It's not an evidence-based, right? And there is a lot of really good evidence and data and studies coming out now to help steer us and how we can really help with the root cause of people's metabolic issues, right?
Yes.
And interesting ways of treating it as well.
Yes, that's right.
Yeah. So what else? What else do you love? What else is a passion for you?
I find the expanding information and data, frankly, research we have around brain health to be also really compelling. It lends itself nicely to functional medicine because, well, I think traditional medicine, we're trying to offer sort of one pill solutions. And, I am all for studies. I hope we get more of those.
Are we talking about cognitive issues?
Thank you. Like Alzheimer's risk,
Alzheimer's,
mild cognitive impairment, cognitive issues. But also, there's some idea that even things like ADHD and some psychiatric diseases are all, there's this brain energy book that came out, and there's some data that there's a lot of overlap there too. So anyway.
Brain health, which goes beyond just cognitive. I mean, there's Parkinson's, which is very much, I always view that as very much of a toxin driven, toxin load, damaging the brain, in Parkinson's. And it's like there's an epidemic of Parkinson's disease now. Yeah.
I think that's like just such a ripe place to intervene for people.
Yes, 100%.
Because it can really,
especially at the very beginning when they're first diagnosed. Yes. Yeah. And so what are your thoughts about brain health? So we're looking forward to developing, right, the brain health program here. Right?
Yes, I am. We've already started putting ideas together. I'm really excited to put together protocols for helping people optimize cognition, to optimize both lifestyle, both medications, supplements, diet, stress. I mean, you have to do everything, but to pull all the levers we can so that people can expand and extend their health span, so that we can all live as healthy as we can.
So maybe we'll pivot to talking about anti-aging for a second, right? Because that's the other crazy exploding place. And I will tell you, like, I have so many patients that say that just, I'm taking NAD. I'm like, okay, and they're busy, like they want to do it, right? And they ask me, is it good for me? Should I take it? And I'm like, right? Because, so what do you think of NAD?
Oh, I think that oral NAD, the evidence is not there any longer. We actually talked about this with a patient now, so we both think that there's some evidence for IV, but kind of a pain in the butt. So we have to sort of weigh the risk and benefit for each patient.
Right. And so I have people taking it orally for a long time, and part of my data brain, which is similar to, is like, well, what can I measure before they start taking it to know it's helping them? And so that's something we are going to figure out here before we start giving out NAD. We do offer an IV here, and I think there's good evidence for IV, but it's kind of like you have to stay on it, which is a hard thing to do. So the reason why I'm bringing up NAD is not because I'm telling everyone to take it at all. What I'm trying to explain is that I believe every program should be a very comprehensive program. And I know we've talked about this, and you don't just take a pill. It's not just about taking one. If you're a lifestyle and you have a lot of inflammation and oxidative stress in the body, your brain's on fire for other reasons, you're aging, you're accelerated aging because of metabolic issues. Unless you address all of these things, you can't just take an NAD and think it's going to fix everything. And so the anti-aging, the anti-aging program or a comprehensive view of anti-aging is really to do, as you say, to look at all the levers involved, right? And and genetics too, right?
Absolutely. I think knowing your genetic risk you can intervene. That's the thing. Like, it wouldn't be useful if I just said, here's your genes, good luck.
Right. But so there's some great advanced functional genetic testing that we can contribute into that sort of question. So I'm looking forward to putting together what will be really offering everyone in the coming year for a comprehensive anti-aging program, because like I said, I actually have most of my patients coming off their just NAD pill because it's just
Yeah.
like I'm just not convinced it's doing anything. When it comes to supplements, I believe, is it good for me and do I need it? Is it good for me and do I need it? And so there are a lot of things out there good for you, but the question is good for you, right? But do you need it? Is it going to move the needle for what your health
Yeah.
goals are?
That's right.
So I think we always spend a lot of time trying to really see what people need and what
Mhm.
will actually move the needle, right?
Yeah, which is why there's a lot of data coming out now about which are the actual which are the like, is this drug really effective? Is this really going to prolong my life? Is it going to prolong my health span? How does this
Data for what kind of drugs? You
Well,
mean some conventional kind of drugs you need?
no, I just mean people are studying
Yes.
like many
Yes.
possible this ITP program where they're investigating possible drugs. Peter Attia talks a lot about this, and I think his work is phenomenal
Yes.
as well. So I just think over the next few years it's going to be fascinating. There's this, I'm
That
waiting
health
for this.
span versus
Yeah, it's like,
lifespan.
what is this
Yes.
rapamycin dog study going to show?
Yes.
Like, we're all kind of like on the edge, like waiting for some of this data. But as soon as we believe that, like, yeah, this one is actually, the juice is worth the squeeze, like,
Yeah.
that's going to be in the program.
Yes. Good.
So
Excellent. Yeah, I've been reading about rapamycin too.
Mhm.
So that's great. Is there anything else that you want to talk about today, or tell everyone about yourself? It doesn't have to be.
Yeah, I don't know. I think like
Any other passion you have, whether in medicine or, I mean, look, at the end of the day, you're also a core functional medicine person. So healing the gut, detoxing people, helping people detox, those are all tools that you're very good at from, just the core of the functional medicine 101 toolkit, right? And so
yes,
those
all
are the
the
tools we
basics.
do. So anyone with gut issues or even autoimmune, because, repairing the gut and lowering toxin load and
Absolutely.
all that are very
Dysbiosis.
core
That's all.
foundational pieces. But I appreciate that the areas are sort of, in a way, they're programs that we're really putting together right now, which will be exciting. Yeah,
Mhm.
as well as
I believe every patient deserves the chance to be healthy, and I look forward to helping you, if you come here, to helping you optimize your well-being.
Yeah, very well said.
Yeah.
So thank you.
Thank you. Thank you. It's a privilege to work with you.
Yeah, have a great
Yeah.
day. Have a great day, everyone.